Number 13, miscarriage. A miscarriage refers again to that loss of the baby before the 20th week of pregnancy, and about 10 to 15% of pregnancies do end in miscarriage. Even more people have probably miscarried before they even realize that they're pregnant. Severe cramps or pain into the belly is one sign of miscarriage. Other symptoms are heavy spotting, vaginal bleeding, vaginal discharge of fluid and tissue, and mild to severe low back pain. So if you're pregnant and you have moderate to severe cramps or abdominal pain, you might consider getting checked out for that as well. So if there's many women that have gone through some level of a miscarriage that pregnancy for whatever reason didn't take, and they're getting those symptoms, the spotting, the back pain, the severe cramping. Number 14, pelvic inflammatory disease, PID, pelvic inflammatory disease. And this is an infection in the female reproductive system. So before we went through the urinary tract system with a UTI, this is really an infection of the female reproduction system. And it starts when bacteria can get into the vagina and travel up to the ovaries and the fallopian tubes, or possible other reproductive organs. So PID usually is caused by a sexually transmitted infection like gonorrhea, chlamydia. And it usually occurs about 4% of women in the United States. At some point, they get pelvic inflammatory disease. But the pain that they get from this is usually occurs in the lower abdominal, lower belly region. It can feel tender. It can feel achy. Other symptoms that they might get, vaginal discharge. We talked about with chlamydia and gonorrhea before. Vaginal bleeding, fever, pain with intercourse, painful urination, or a frequent need to urinate. So again, pelvic inflammatory disease can mirror some of those symptoms of a UTI as well. That the biggest thing is I'm seeing there is that lower abdominal pain, that feeling of tender and achy in that abdominal region. Number 15, ovarian cyst rupture or torsion. So cysts are fluid-filled sacs that occur from your ovaries or in your ovaries. Most women get cysts, so that's pretty normal, but you usually don't have any problems or symptoms with them. But if a cyst twists or if it breaks open, so it ruptures, it can cause pain to your lower belly on the same side of that cyst. And that pain can be dull to sharp, and it can come and go. It can be on and off. Other symptoms from a cyst are kind of, it's a big list. Feeling full in the abdominal region, an ache in your lower back, pain during intercourse, unexplained weight gain, pain during your period, unusual vaginal bleeding, the need to urinate more often, bloating, fever, vomiting. So again, if your doctor should see you right away if the pain in your pelvis is severe and you have a fever with that pain as well. It could be a sign that a cyst is ruptured. Okay.